Namaste, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. Namaste, sir. Today it seems that physicians are, what shall we say, adding tonics to all of their, whatever their treatments are. Why is that?
See, actually, when patients are there, we consider that we have to treat the disease first. Sometimes, especially in chronic diseases, if you give tonic, the symptoms get palliated. They get draped. So the real picture, it's very difficult to understand whether the tonics have energized the person and that's why the person is feeling well, or there is reversal of the disease, or there is cure. So it is always a good idea that unless it is an emergency, you should avoid giving tonics during the treatment, because it can give a false, improvement feeling. And therefore, it is better to help the patient to recover first, get cured, and then for convalescence, you can add tonics.
Oh.
But it has become actually a routine where, like they give antibiotics. And with antibiotics, what happens? That the intestinal flora of friendly organisms also get disturbed. And there is disturbance in the friendly organisms, flora in our intestinal tract.
Yes.
And therefore, we come down with vitamin B group deficiency. Because all these vitamins, especially the B group vitamins, are synthesized in our own intestinal gut, the tract, with the action of friendly organisms, bacterial culture. And therefore, they give probiotic, that is fine. But they give even vitamins as supplements to overcome the deficiency. Then there are people who give what we call enzymes. And then these enzymes make you almost like, it is like a false improvement. And therefore, patient starts feeling better. But that feeling better should be with the reversal of the disease and not with the help of tonics. So it gives sometimes a deceptive picture. And that especially in chronic cases like tuberculosis. In tuberculosis, the first thing happens is person loses appetite. So loss of appetite is the first symptom in tubercular infection. And there, if you go on giving tonics for improving appetite as well as some vitamins to feel energetic, they routinely give vitamin A, vitamin E, and B group vitamins as well as vitamin C, and even enzymes. And that gives a false improvement, and the disease continues to progress.
So when they give all of these vitamins, what happens to the system? Doesn't it help the system?
So naturally, when you give the vitamins, it would be a booster to the system. It will energize. And definitely that can drape the natural symptoms of the disease. So physician will not be able to assess whether the improvement is because of the reversal of the disease phenomena or it is because of the tonics given. So it's really sometimes, deceptive improvement is there, which is not useful for the physician. So it is always better to diagnose the case, treat the disease, and once the disease proper has been treated and it has started reversing, then you can add tonics as a supplement. And then that will be a real sustained improvement. We have seen in some cases like tuberculosis. If the tubercular infection is there, fever also, the evening rise of temperature is very much marginal. Even person doesn't realize. The first symptom in few cases would be loss of appetite, though the infection is in lungs. But as a response to the infection, first the appetite is lowered, and that low appetite can be the symptom of tuberculosis. Whereas if you go on giving appetizer, definitely that will give false improvement, and then the diagnosis of the tuberculosis will not be properly done, timely done, and the intervention also will not be timely. So there are cases where the tonics would be needed, but that only as a supplement for convalescence, for early recovery once the disease has reversed. Not only that, along with tonic, they use routinely the antipyretics. For example, if the person has developed fever, now fever is a phenomena where it is just your defense getting roused against some inflammation or infection. So it's a defense, and that is the response of the individual to the disease entity. So there is no point in giving antipyretic alone. So better we study the pattern of the fever, diagnose the disease which is causing this fever, and then after treating it, then you can control fever along with the causative infection. If we control, then you can have, otherwise it will give false improvement. I have seen in children, if the child is having a high degree of fever, there would be toxicity, body ache associated with the fever, and the child will be resting, and even everyone will recognize that the child has fever means there is some infection. If it is a generalized infection like say typhoid or some with some toxins in the body, there will be body ache and all other symptoms. But if it is a local infection, there may not be much toxicity, but the person will be confined to bed with fever. But imagine, like, if you take antipyretic and the fever subsides, the person will be again exposed to exertion and all. So in turn that will be harmful for the recovery of the patient. So giving tonic as a routine to all the patients is not a good idea. That will definitely delay the cure. Therefore, we have to be very rational in choosing the supplements like tonics, and that too, they are justified only for convalescence and recovery after treating the original disease and not before that. Of course, we have seen some deficiencies where it is vitamin A deficiency leading to night blindness. If we diagnose that it is only night blindness is caused by deficiency of vitamin A, then and see, if you give beta carotene or vitamin A rich vegetables, it may take some time to recover. So in that case, with acute deficiency, you can give these supplements like aquasol or these fish oil as a vitamin tonic, and there would be instant improvement. There also it has to be like a guarded and well monitored giving, because these fat soluble vitamins like A and E, even their toxicity is more dangerous than deficiency. So we have to be very cautious in giving these tonics, and we shouldn't overfeed them. We shouldn't even allow the things to get draped by giving tonic for a temporary relief. So the rational use of tonic is essential. And I have seen, for example, iron supplements. You can't give iron supplements as a routine to even iron deficiency anemia. We have seen where they are more constipating. Very few people tolerate iron supplements orally if they are given. So we have to be very cautious. We have to be very, it should be a tailor-made prescription for the person. I have seen even vitamin D3 deficiencies being treated with chemical form of vitamin D3 supplements, and there also people develop a lot of reaction to it in the form of hyperacidity and all. So where there is no acute emergency, you should avoid giving tonic. It is better to treat the disease proper, the deficiency proper, and then add tonics as a supplement, and not otherwise. Even in nutritional deficiencies, if we diagnose the nutritional deficiency, or we call malabsorption syndrome, where the nutrition wise it is available, but our system can't absorb it, can't assimilate it, or can't use it, and in that also we have to diagnose it and treat that condition in the background first, and then add supplements as a tonic or something. Otherwise, giving directly tonic is not useful, rather, sometimes it becomes a harmful thing.
How do you define the word tonic? Is it liquid? Is it vitamin?
Yeah, they are in both the forms. They are then liquid or capsules or tablets, because the contents like vitamin A. And in that also we can call natural vitamins, like directly fish oil is given. So they are not chemical forms. They are natural forms of vitamin A from fish oil extract and all. They are given. They are given in the form of capsule. Nowadays they are giving this what we call algae, which are very rich in nutrient quality.
What
They
are they?
give. They are algae where even 1 gram of algae powder is giving you a lot of nutrients in it.
Okay.
Yeah. So they are also available. So such tonics are there in many forms. Even vitamin C. Vitamin C is again extracted from the citrus fruits like lemon and all. They give. That also good idea. Like earlier, for common cold and all, people used to give vitamin C routinely instead of giving anti-allergic or steroids.
There was that Dr. Linus Pauling who recommended huge doses of vitamin C.
Yes, and then what happens? When vitamin C is given, the immunity gets boosted. And the best part is vitamin C is a water soluble vitamin. So if excess amount is consumed, it is excreted through urine. So it's not dangerous. So vitamin B and C can be safely taken. Unlike
B also.
B also is a water soluble thing. So, but A, E, D, these are all fat soluble vitamins, and which should not be given irrationally unless they are well monitored with the deficiency.
What about when people are just tired, exhausted? Can tonics be given?
That is what here. If they are tired because their electrolytes are depleted, or sodium depletion is there, potassium depletion is there, or calcium depletion is there, these things will have to be diagnosed. You just can't go on giving tonics and minerals just to enrich and make them more energetic. Sometimes, like for example, I'll tell you, if the person has a thyroid deficiency, and if the person is feeling tired, lassitude, in thyroid deficiency we have seen a person, like the person is thirsty, and there at some distance water is kept, and person needs to drink water, but he will wait for someone else to go and bring it for him. He would wait for that. He won't have that energy drive to get up and rise and go. So it's an energy thing. So in hypothyroid, lassitude is there. In that case, if you give tonic or some mood elevators and all, because sometimes you get even depression out of these hypothyroid symptoms. So if you give mood elevators, it won't work. It will just drape. So we have seen some cases where they land up in that extreme myxedema condition with hypothyroid. Till then they don't heed to these symptoms, because they are all palliated with instant tonics and energizing medicines. So things get draped, and the early diagnosis will not be there. So we have to study. If person is feeling weak, we should just study why person is feeling weak. We have seen some person, like I remember one case where he was complaining of lassitude. His lower limbs were feeling weak, and he said that if I don't intervene, they may just get paralyzed. So much weakness in lower limbs, and no other reason was there. And then we realized that he was taking conium maculatum homeopathic tincture in undiluted doses, concentrated doses, and that was causing proving. Now you tell me we can't give him. He was given a lot of tonics by the physician. Then when we inquired, like illnesses, medicines, what he had taken. He told, I'm taking conium for last 2 months. And then we just stopped it and immediately he started improving. So better to diagnose the whole phenomena, understand it, then remedy it, and then as a supplement for quick recovery during convalescence, you can add tonic.
Only if necessary.
Only if necessary, and that will just give boost. Otherwise, naturally, person can. But sometimes what happens, like your intestinal flora, if it is disturbed so much, maybe because of natural infection or antibiotics, then the natural recovery may take a lot of time. So in that case, we can add B group vitamins and C vitamins like that to boost the energy, and definitely person will be benefited by that, but not otherwise.
Thank you so much, sir. Well, I will be away for a few months, and when I return, we will continue with our program on homeopathy. Namaste, sir.
Namaste.
Namaste.